Working up into the thigh and the upper leg, it's going to take a bit more time. There's a lot more surface area and quite a few more muscles. Again, continuing to use the flathead of the massage gun, I'm going to get in and around the muscles that surround the knee, the soft tissue, the insertion of the iliotibial band, and especially those muscles that help control the attitude or the position of the patella, the kneecap. Following the quads all the way up to their attachment points up on the pelvis, but then spending quite a bit of time in the belly of the muscle. A lot of times these muscles get overworked on many of us who are doing a lot of standing but are also very quad dominant, where we're using more of the muscles on the front side of the thigh. Now I'm really trying to get into the adductors. A lot of times adductors feel tight and can be mistaken as hamstring tightness. So spending some time here can help get better blood flow and release those. They can get quite painful, so be careful with your pressure. And now I'm spending a little time on what's called the VMO, or the vastus medialis. It's oftentimes implicated in pain, especially around the kneecap. And then getting up into the anterior part of the thigh and the rotators around the hip. Switching sides and doing the same thing on the opposite side. That compartment on the lateral side of the knee, on the outside of the knee, is quite thin and the bone is just underneath, so be careful as you get into that knee. On that side, you might find that there's a lot of tender spots and trigger points. Again, getting up into that anterior thigh and into the adductor, you'll oftentimes find that one side is considerably tighter than the other, especially if you do a lot of standing, because most of us have learned how to stand in one position and put most of our weight on one leg. And again, around that VMO, the vastus medialis. Take your time on these muscles. If you find areas that are causing you difficulty or discomfort, you may spend more time in that area, lighten up your pressure, and just spend more time paying special attention to those areas where you need the extra help